Namaste friends. Today my point of discussion is morning meeting points for a housekeeping HOD or housekeeping in charge. So first of all that the morning meeting happens at 9 a.m. or 10 a.m. Many of the HODs keeps wondering that what point the management will ask from him during the morning meeting time. So I have made a short brief presentation where if you will keep your data ready, then there will not be any trouble for you in the morning meeting, or your management will never feel that your HOD doesn't know about the departmental operations. Usually in hospital, the housekeeping, the cleaners and the GDS general duty assistant comes under the housekeeping. So first of all, you present your total outsourced staff deployed yesterday. How many were there in morning, evening, night and total. You can also put your outsourced deployed for the morning shift. Mention deep cleaning or terminal cleaning done in any of the areas or room. Thereafter, mention about the complaints happened related to your department. For example, delay in services, cleanliness issue, rude behavior of any staff done with any of the patient or attendant, etc. Mention the under repair or out of order areas in that report also. The fascinating things to let your management know about the calls which you receive and get done. The calls you may receive through the staff, nurses, doctors, technician, etc. at your desk, and your take time of completing those calls should be you should try to cover during your benchmark timing. In any of the hospital, the main concern of the housekeeping department remains the timely assistance of patient, especially in urine port and bed pen assistance. So for that, your benchmark should be 10 minutes, that whenever you get a call from patient side or nurses side, your staff should reach there within 10 minutes. And you in your data you can figure out how many calls you have completed within 10 minutes, how many took beyond that. So in by this you can calculate the patient satisfaction ratio, that how many calls you are getting done within your the timing of 10 minutes. And if dissonance happens, that happens because of the delay in service. That's why I mentioned 12 to 19 minutes and 20 minutes. And accordingly, the management can think if you require any extra manpower or extra assistance in order to complete the calls within the benchmark timing. Another important feature is the TAT for attending transport call, for dropping patient to the discharge, for discharge, OT, X-ray, examination rooms, doctor's chambers, etc. So the benchmark set for this should be 15 minutes, that if you get a call from nurses side or the patient attendant side through nurses that the patient has to be taken to there by wheelchair stretcher, so within 15 minutes or 10 minutes you should make your staff reach there. And if it is more than 20 minutes, then there may be some dissonance from the patient and nurses side. And if the calls is beyond that also, for example, it is for 30 minutes it has not received attended, then the patient get a dissonance and they can shout on you also. For such situation you have to prepare the RC and CAPA also, why this call got delayed. Your staff were not on floor, he was busy somewhere, or staff has done the negligence. So once you will prepare all this data on daily basis, you will be comfortable to present yourself in the morning meeting. So this is all about it.